Hi, everyone. It's 12 o'clock, so we'll go ahead and get started. Welcome to the first day of Lunch with Links. My name is Brooke Zering, and I'm the COVID-19 training coordinator for the immunizations program. Joining me from the Links team today is Judy Green and Katie Lee. They will be presenting on today's topic, which is patient demographics in Links. This presentation will be recorded and later posted on the Links website, which is lalinks.org, under the Links training video button shortly after the training has ended. During the presentation, please type any questions you may have in the chat box. There will be a Q&A session following the training where all questions will be addressed. We're trying to figure out the audio. Just 1 second.
Okay. Good morning.
Okay, we can hear you now.
Okay, great. I was double muted for some reason. Okay, great. It looks like we have a good crowd today. I'm Judy Green, and I'm the operations manager for the Link system. So today we're going to go over finding, entering, and updating the demographics in Links. So I wanted to start out by just giving you a few pointers on Links. There are two different kinds of logins that you can have to Links. You can have a facility login, which is where you log into the system and you're connected to just one facility. Then there's another login that's called organization login, and that is if you work for an organization has many facilities under it, for example, Osner Health System, LSU Health System, then you're able to log in, and when you do, you are required to select the particular facility that you're working in that day. I'm going to kind of show you that before we get started with anything else here. So if I have I'm going to go to the Links homepage. Everyone can see my screen, correct?
We can see it.
Thank you. Okay, on the Links homepage, I'm going to log in. And I'm going to enter my login name and my password. Oh, and it's telling me it's invalid. That's not very good, is it? Maybe I better try another one. Okay, let's try. Okay. Now, the one I logged in now is when you have an organization login, and once I log in, it's going to take me to the organization COVID test site. It should have asked me to choose an facility at that time. If it does not, I have to go over to select facility because I must be in an organization and facility to work. So I'm going to choose the COVID test site and continue. Now, as you can see up here, I'm logged into the COVID test site and the COVID test site facility. Once I get to this site, my patient search screen comes up. The first thing I want to do is I want to search for my patient to see if that patient is in Links. We always recommend that you search by the first initial of the first name and the date of birth. There are several reasons for this. Number one is if you try the first name and last name, and the name is not spelled exactly as it is in links, it's not going to find the patient for you. But if you use the first initial of the first name and the date of birth, you're generally going to be able to find your patient. So I'm going to look up a patient called Test Ryan. So I'm going to put a T for the first name, and I'm going to put his date of birth in is 07/26/1956, and I'm going to do a search. And as I come in here, I'm not going to see that patient, and I thought I had that patient for, maybe it's Ryan Test. Let's try Ryan Test. Somebody messed up my notes here. It must have been me. So let's try Ryan Test. And they'll always be alphabetized by the first name or the last name. You can alphabetize them either way. If you hit the last name, you can find, if I go down to Ryan Test, you see I see my patient right here, so I'm going to select him. And once I select him, you'll see that I see the last person that had anything to do with my patient. But what I want to do is I want to be sure and update my patient so that he will have all the information he has for my site. So I'm going to go down and I'm going to edit his record. And there are some mandatory fields that have to be completed. One of those is the race. So I'm going to choose a race. One of those is ethnicity. I'm going to choose ethnicity. The last name, the birth date, the sex, there. This is an older patient, so they're always ineligible for VFC because we're dealing with COVID vaccine mainly, and all these patients are going to be past the VFC age. Then I'm going to go down to my address field, and I'm going to key in my patient's address. And when I do, I can simply go over then to the zip code area and type in his zip code, hit the tab key, and when I do, it will automatically put my city, my country, and my parish, and my state in there for me. I don't have to enter any of that information into the system. And that's really important too, because it's so easy to misspell a city or something, but if you put that zip code in and go to your next field, it will automatically populate that. Then what I have to do is I have to decide what address type this is. And I'm going to say this is my patient's legal address. I'm going to say, yes, it's valid. Yes, it's his primary address. And I'm going to simply click Add. It's going to bring me a little thing and says, the following address will be marked as the primary address. I'm going to say, okay. The next thing I always want to do is I want to be sure and add a phone number. We prefer that you add a home number and a cell number. If they don't have a home number, a lot of people just have cell numbers, which is fine. So I'm going to go here and I'm going to add a phone number. And this phone number is going to be my primary residence number. I'm selecting the equipment type as a telephone. This is my primary number, and I'm going to click on Add. Once I do that, I'm also, if my patient has a cell number, because we're able to send text messages out to patients that need when they do their next vaccine. So it's real important to always get a cell number also if you have one. So I'm going to say this patient has a cell number. And I'm going to say this phone is an other residence number. The equipment type is going to be a cellular phone. It's not the primary number, but I'm going to add it. Once I've done that, that's the main information that I need to have in the system. And I'm going to go right here and I'm going to save it. And now you'll see all my patient's information is now entered into my system that I need. Do you want to open up now for questions on updating a patient record, or do you want to go ahead and show how to add a new one before you do that?
It's up to you, whatever is easier for you.
Yeah, I think it would be easier if they have any questions on this part. Let's let them ask questions on this part, and then we'll go to the adding a new patient in.
Okay, if anyone has a question, either type it in the chat box or you can unmute yourself.
No questions? Great.
Yeah, I'm not seeing any, Judy, if you want to continue on.
Okay, great. Now we're going to add a new patient. We're going to do the same thing that we did with our previous patient. We're going to go back now to patient, search and add. And this time we're going to look for our patient, and our patient's name is going to be Frank Test. So we're going to put first initial is F, and we're going to put his birthday is 08/25/1955. We're going to go down and we're going to do a search. Same as we did before. And you'll see that if I go and alphabetize it by the last name, I don't see my Frank Test in here at all. So what I want to do now is I want to add Frank as a new patient into my system. So I'm going to go up here where it says check here, adding a new patient. I'm going to check this box, and it's going to tell me I have to search again. And it's also going to show me the required fields before I can do another search. So I'm going to put Frank, the rest of his name in here. I'm going to come down to his street address. And I'm going down to his zip code. I'm going to tab over, and it's going to fill in the Shreveport, Louisiana for me. That's the only thing that I have to add in order to search again to see if I need to add him as a new patient. It requires me to search again because if in fact it finds anything that looks similar to this name, and it will tell you before you add him, make sure the patient you want to add is not listed in the patient search results. I say okay. If it had found any other Frank Test down here, even if they had a different address, it would have listed in there for me to make sure that that wasn't the person I was looking for. But we don't see anybody down here that's similar. So once that we do that, we're going to go right here and we're going to say add this patient. And once we do that, it all opens up just like it did before. We're going to have to select a race. We're going to have to select an ethnicity. We have his first name, last name, his date of birth. We're going to have to select his sex. Then we're going to go down and we're going to check everything here. It has his address, his city, his state, his parish, et cetera, et cetera. We do like to, if we can get an email address, it's always real good to put an email address in here. The address type, we're going to have to select what type of this address it is. It's his legal address. You see it's already checked valid. It's already checked his primary because that's what we put in there. Then we're going to say add. It's going to ask us again, is this correct? If so, it will be marked as his primary address. We're going to say yes. We're going to go down to his phone number. We're going to enter a phone number.
Judy, there was a question. I'm sorry, I didn't mean to interrupt you. There was a question that says, can we enter only cell numbers?
Yes, that's what I was just fixing to do. Yes. Mm-hmm.
So it's only cell phone numbers?
Yes, this person only has one type of phone, and this is his primary phone. We're still going to say, because it's only his phone, it's still his primary residence phone because it's a cell phone. We're going to say cellular phone. It is his primary phone, and we're going to add it. There's so many people this day that only have cell phones. They don't have residence phone. But we still consider that, even though it's a cellular phone, if that's the only number we have, we consider it to be their primary number. And you see we have the equipment type as cellular phone here. And then once we've added that, we can go down and simply save our patient. Now, that's how simple it is to add a new patient. I do want to show you a couple other features here. If in fact, I'm going to go edit this new patient I have. And as you'll see, we have many, many other things down here. With COVID vaccine, these are the main fields that we need. However, if you're in a clinic that has, you have chart numbers or medical record numbers, if you so desire to put that medical record in here, you can enter their chart number or their medical record in this field. That way, when you go to pull that patient up again, when you log in, you can actually enter his medical record number. Y'all, I'm sorry my computer's slow today. I do apologize. Okay, so what I'm going to show you here is if I go back to patient add, that I put his medical record number in here, he comes back into my clinic again. I can go into the chart number field right here and put his medical record number or chart number in there, key it in and do a search. And it will pull that patient right up for me. I don't have to go search for him. Every patient in the system also has what we call a SIS patient ID number. It's a unique number for every record that's on our system. If I take this number right here, and if I have it keyed in on their chart or on their record, or if I give them a personal record and they come back with that personal record, that number is going to be on any kind of document that we give them. And if I go in with this particular number, and he comes back in and brings me a personal record that we've given him or a certificate that we've given him, I can actually go in and key his number in under this SIS patient ID number. And I thought I got it, but evidently I didn't, so I guess I won't be doing that, huh? Let me go back to sorry about that. I thought I cut it to paste, but evidently I did not. So let me get back to the demographics on him. So if I take this patient's number right here, and I go back over to my patient search ad field, and I key that number in under the SIS patient ID number, if you do it correctly, and I hit search, it will also bring that patient up for me. Okay? Any questions on that, on adding a new patient?
There are a few questions in the chat box.
Okay.
One says, is the address type necessary? Can that be left out if clicked ballot and primary already?
No. What the thing about the address information and links is the address information is a HIPAA regulated field, so only your clinic will be able to see the information that you put in. So you noticed when I pulled that other patient up earlier that there was no address information in there because that patient belonged to another clinic. So in order to have the information from my clinic so I can recall this patient or I can phone this patient or whatever I need to do, I need to update the address information in my site for this patient. All that's private information except for the facility that enters the information in.
The next question is, if he has a house phone, would we add that or just the cell number?
You can add either. If you just want to add the cell number, that's perfectly okay. And actually, we would prefer, if you're going to only enter one, we would prefer that you enter the cell number, because we have what we call a MyIR, and MyIR is about to become where any of our patients or any of your clinic patients or your facility patients, that you'll be able to send them an automatic text message when their next vaccine is due. So actually, cell number is preferred over house number. Any other questions?
That's it in the chat. Oh wait, there's another one. So if they're mailing or primary so if it is their mailing or primary address that needs to be put in?
Yes. Their mailing address is what we need in there. Yes. But now when you go in, and let me just say that, let me open this record back up again. If you will notice right here, I think. You have the option right here of addresses, and as you can see, this is their primary address right here. Then if you so desire, if they have a post office box, you can select this as physical address, not or you can, if I had put address used as correspondence address, you could say valid and add it, and you'll have the post office box and their legal address. So then you have a mailing address and a legal address.
The next question is, if you enter the wrong date that the person got the shot, how do you change it or edit it?
Okay, that will come under tomorrow's topic. So we'll save that for tomorrow.
Okay. Does the text message only apply to COVID vaccines, or will it become available for immunizations too?
It will become available for all immunizations that the patients do. We'll be using it a lot, especially with our BFC patients. Any other questions?
That's it in the chat box right now. If any, okay, wait, one other person has one. She's typing it.
Okay. Okay. Excuse me. Additional fields that you can fill in on your demographics page is you have some secondary demographic information where you can actually key in any type of allergies the patient has. You can key in a lot of, especially WIC patients, sometimes they'll key in the number in the family, information such as that. Some private clinics, they like to key in the insurance plans and the insurance plan name, et cetera, et cetera. Just different, there's different type things that you can key in here. Anything that you put in these fields are all private information for the clinic that entered the information into links. It will not be viewable by anyone else.
The next question is, if you assign a chart number, sorry, it keeps moving. If you assign a chart number with historical data, from other sites still show when you search them, or will the site automatically set to your site?
No, the chart number is automatically set to your site and no other. If I logged in under the Louisiana Immunization Program and keyed in the chart number I just put in for this COVID test site, they would not be able to pull the record up with that chart number.
Next question is, one problem we have finding is that a person has a chart under another name, maybe a maiden name, or the name is spelled, I'm guessing, incorrectly. Sometimes the birth date is wrong. There is nothing we can do about this, but do you have any other suggestions on how to handle this?
Yes. Okay, let's say, let's just go in. Let me give you an example of that. We have so many chest patients in here. We always recommend, as I said, that you search by the first initial and the last name, and that's one of the reasons too, because if you come in and you search for, if we search for, let's say, oh, I have so many test patients in here, I really can't tell you, but if I go in and I search for a patient and that patient's first name comes up, but their last name doesn't come up. And let's say it was Mary Jane Simpson. And so I say, do you have a maiden name? And she'll say, well, yeah, it was Mary Jane Doe. And so I'll say, now I have a Mary Jane Doe in the system with the same date of birth. I said, could that possibly be you? And she said, she'll say usually, well, yes, I'm married. You know, that was the last time, that was when I was a child, that was my name. And so a lot of times you can find the patient that way. And that's another reason we suggest doing the first initial and date of birth. Now, if she says no, and then you can always go and search the last initial and the date of birth, the same as you can the first initial and date of birth. What that will do is that will pull you, well, I certainly didn't want to do that. Let me clear that because that's going to give me everybody. Okay. So everybody in the system that has the last name with T, it will pull me, even if I don't have a birth date, it will pull all of them up there for me. The other thing is, if I put in, let's say Chester Smith, let's see if we get lucky here. If I put in just if I don't get any luck there, and they say, well, I know I've gotten immunizations from my clinic before when I was a child, or I got them at the health unit, et cetera, then I can put in the first name and the last name, leave the date of birth off, do a search. Watch me not have a Chester Smith. I just pull that out of the air. Oh, I do. Okay. So then I can look here, and let's say she said her date of birth was 8/4/1943, and here I see a Chester Smith with 8/3/1943, and she said her birthday was 8/2/1943. So then I can say, well, what is your middle name? And if they said Lucas or something, and I could say this could possibly be the same person, and then I would look up and I could choose this patient, and I could say, did you ever get any of your vaccines at Ochsner Health System or at the Covington Health Center in Covington? And immediately if they tell me, well, yeah, I got my flu shot there last year, I did this, you just about know that it's really the same patient. So there's ways that you can look and you can question the patient and just about decide that this is the same patient. And you'll see this a lot, y'all, with people that get their vaccines at Walmart, CVS, these big pharmacies. A lot of times they're keying so fast that they'll key in accidentally the wrong date of birth. As a matter of fact, with COVID vaccine, we've even found some that keyed in the date of birth as the date they gave the vaccine. So there are different ways like this. And I'll tell you another thing. Let's say that you went ahead and you put this Chester L. Smith in with a date of birth of 8/2/43. Well, it's very likely that record is going to be thrown into what we call a manual deduplication, because let's say the address is the same that we already had in links, and it's going to send this to us. And we have people that spend all day long every day looking at all these records that are thrown into manual, and it'll throw these two records up to us, and it'll say, now we got a Chester Smith that was in links that has this address with this birthday to 8/2/43, And today they put a new one in with Chester Smith with 8343, and it's going to say to us, in other words, is this the same patient? If so, we will combine those records. So there's many different ways that that will happen.
If a patient is transgender, what sex do you enter?
Other.
Is your reason for blinding address information, HIPAA regulations, the same reason for blinding race and ethnicity information?
Yes. It's all HIPAA regulated.
In the case of date of birth, if the date of birth is incorrect, should we also search by first and last name?
Yes. And if you find a date of birth that is actually incorrect, let's take Chester Smith here, for example. If I find that after I look at him and I find this really is his record and his birth date really was 8243, and I have enough evidence that I can actually, when I edit this patient's record, I can actually change his date of birth.
Says if their name was legally changed, we edited the demographics, but the report still shows their previous name. Is there a way to fix that?
If their name was legally changed, when you change in the demographics, you can change their name in the demographics, but you want to have a legal copy of the change of their name. Yes.
Does it matter if the organization level is inactive, or should they all be changed to active?
Now, when you update the what you're really talking about is the state level, but when you update the information in the demographics, it's going to automatically change that to active.
That was the last question. And it looks like we're at time as well. So
Okay.
I want to thank everyone for attending today's training. Tomorrow's training will be on vaccine administration for anyone who is interested. For a complete list of trainings this week, you can also visit the provider information webpage on the LDH website.
Also,
Thank you.
anyone that has a question, and if you're trying to enter into links, any kind of demographic information, please notice that on our home page, we have a chat box, a help desk phone number, and a help desk email that you can send your questions in. Thank you.
Thank y'all. You have a good day.